if you went to a hospital, you would have the same things at your disposal in our clinics. Difference primarily is that you come to our clinic, you register directly with us. If you've been in our system before, that registration is already there, and parking's right outside the door, so the experience is much more quick than going downtown, going to the hospital, finding parking, going to registration, and going to the department. So we've tried to replicate that same facility in an outpatient basis.
Imaging at large clinics and hospitals often requires difficulty with parking, traveling through a complex hospital, often by very sick patients.
Many of them know that what that usually means is driving to the hospital, finding parking. First, it means can they even get an appointment in the next few days or in the next few weeks. If they get that appointment, then it requires driving to the hospital, finding parking, walking into registration, waiting to register, finding their way through the hospital to try to get that test done, waiting even longer, waiting for emergencies, which then will take their place. And then by the time they leave, it's literally been half a day that they've spent there getting that one test. And then it usually takes several days or even sometimes weeks for that report to get to their doctor. And what we've tried to do is really take that whole experience and completely change it.
With our whole electronic architecture, from our scheduling to the interface with the modalities themselves, and the modalities are MRIs and CAT scanners, ultrasounds, etc. It really helps us streamline that process so that if you are getting an imaging examination, your physician office can call us, fax us a report. They can even deliver that to us electronically. You can come in, we already have that information, the registration process is very quick. You park right outside our door. Because we're able to manage this process and the schedule electronically, we're able to, I think, with the exception of emergency patients that sometimes throw our schedule off, we're able to keep a fairly predictable schedule time so that if you come in for a 2 o'clock CT scan, you're not going to be sitting out in the waiting room until 4 o'clock.
We try to perform services within as little as a 15-minute wait time for patients, and most studies are read within 24 hours for a quick turnaround report to your physician.
We're able to see patients and do their CAT scan or their MRI or their X-ray procedure the same day. We will have a report back to their doctor within 24 hours, usually the same day.